Hello, my name is Chase Deloach, and I'll be discussing depressive disorder. Major depressive disorder is a mental health disorder characterized by persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. You may have trouble doing normal, day-to-day activities, and sometimes you may feel as if life isn't worth living. Major depression is one of the more common forms of mood disorder. Depression may require long-term treatment, but is worth it if you want to feel a whole lot better. Some depression is normal after the breakup of a long-term relationship, the death of a loved one, or the loss of a job. A severe form of depression that interferes with the concentration, decision making, and sociability. Causes of major depression: occasionally depression that can result from and be reversed by treatment of certain medical conditions like hypothyroidism. The biological causes of depression are not well understood by psychological trauma or stress that are important in predisposing and exacerbating the condition. This depressive disorder affects us by 15 million people in the United States suffering from major depression. 6 through 10% of the United States population is clinically depressed. 1 in 5 people in the United States experiences major depression at some point in life. Women are twice likely to experience major depression as men, with 1/4 of all females to encounter at some point during their lives. The 3 types of depression is anxious distress, depression with unusual restlessness or worry about possible events or loss of control, psychotic features, depression occupied by delusions or hallucinations, seasonal pattern, depression related to changes in seasons and reduced exposure to sunlight. Anxious distress is feeling tense or keyed up, unusual restlessness, worrying that makes it difficult to concentrate, fear that something terrible may happen, and these symptoms must be present most days, or the current or most recent bipolar episode, regardless of whether the episode involved manic, hypomanic, or depressive symptoms. Psychotic features is visual and other hallucinations. The person sees, hears, and maybe smells things that are not there. Paranoia and fear is when the individual may believe that they have done something terrible or that someone wants to cause them harm. The person may be certain that something is true when it is not. Seasonal pattern: changes in the body's internal clock due to seasonal changes and imbalance in the chemical melatonin that influences sleep and mood patterns, and personal history of clinical depression or bipolar disorder. These can cause feelings of worthlessness or hopelessness, loss of concentration and interest in activities, nausea, loss of appetite, craving, or for fatty or carbohydrate-rich food. Symptoms of major depression: signs and feelings of sadness, emptiness, or hopelessness, loss of interest in doing things like activities, angry outbursts of things that are not that serious, thoughts of death, suicide thoughts or suicide attempts, tiredness and lack of energy. Treatments of major depression is control stressful events, avoiding alcohol, antidepressants that relaxes the mind, selective serotonin reuptake inhibitors, which is known to control emotions. these are the sites that I use for the project, and I thank you for listening. Bye bye.